Hi, my name is Shannon Holtham, and I'm presenting my capstone and 5-year plan for nursing course 4580 here at Lamar University. Again, my name is Shannon Foytek Holtham. I am currently an ADN RN. For my education, I received a Bachelor of Science degree from Lamar University in Dietetics and Nutrition in 1997. I received my LVN from Lamar State College, Port Arthur in 2016. If you notice the large gap in years, it's because I got married and had 3 children in 5 years and stayed home with my 3 kids. Now 2 of my 3 are attending Lamar University also. I received my associate degree in nursing from Lamar State College, Port Arthur in 2017 and hope to receive my Bachelor's of Science in nursing from Lamar University, expected graduation in May of 2019. My professional career, I have worked as a floor nurse for a major hospital on the rehabilitation unit. I've also worked as a floor nurse on a psychiatric unit of a long-term care facility, and I'm currently employed as a private duty pediatric hospice nurse. My certifications, I am BLS certified, and I'm currently working on my PALS and ACLS certifications at LIT. Humanity and Society, learning objective number 1, practices safe and effective, holistic, patient-centered care to a variety of patients or clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. This was course 4540, Care of Communities. One of the assignments was Global Health Online Discussions. I discussed tick-borne encephalitis for my discussion. Also, the Practicum Project Planning Form 1 and Windshield Survey. These allowed me to determine the standards of care, trends, culture of safety, and other issues influencing community health nursing and the healthcare system. I was also able to assess strategies for clients, families, populations, and communities, including demographics, genetic influences, and epidemiological data. I feel I met this goal at 100%. Lifespan Health Continuum Construct, learning objective number 2, supports patients or clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death and dignity. This is course number 4540, Care of Communities. The assignment was Community Practicum Project Planning Sheet. With this planning sheet, I chose strategies to advocate for the influence of healthcare policy on behalf of clients, families, populations, and communities. With the project planning sheet in specifically, I discussed how a disaster would impact the daily activities and healthcare needs of the community in Port Neches. The specific aggregate that I chose were the elderly in Port Neches. I talked to several community members to assess and determine their further needs. Learning objective number 3 evaluates patient-centered care for patients and clients across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple determinants of health. This was course number 4620, Compromised Multiple Health States. The assignment was discussions 2, 3, and 4. With this assignment, I was allowed to demonstrate the ability to prioritize patient-centered care for patients with compromised health states and adjust priorities in emergent situations by recognizing the signs and symptoms of decompensation. I discussed acute renal failure, types of heart failure, the clinical assessment and manifestations of heart failure, and also brain attacks. I feel I met this goal at 100%. Evidence-based practice and clinical reasoning construct. Learning objective number 4. Then synthesizes clinical and judgment in nursing practice utilizing critical thinking, nursing process, research, and evidence-based practice. Course number 4391, Evidence-Based Practice and Inquiry. Assignments, online discussions number 1 and 2, and the qualitative research article. For this course, I was able to use scholarly critique as a strategy to guide the evaluation and utilization of research in nursing practice. I was also able to explain the link between theory and research as a foundation for evidence-based practice nursing. In my discussions, I discussed nursing professionalism and research and how evidence-based practice is the foundation for research. I also discussed the qualitative research article. I'm sorry, the qualitative research article. Okay, start again. I'm sorry. The qualitative research article. That was an overview of the research process, general characteristics of research design, and also sampling concepts. I feel I met these goals at 100%. Patient-client-centered care, learning objective number 5. Employees safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients or clients and members of the interprofessional and intraprofessional healthcare team. This is course number 4550, Leadership and Management. The assignments, healthcare leadership roles, discussion board postings, and also effective leadership and qualities paper. For this, I was able to summarize essential nursing management tools in the provision of safe and effective patient-centered care as members of the intra and interprofessional healthcare team. I analyzed elements of staffing and scheduling of staff to meet client care demands. I also researched the benefit of healthcare information technology, and I identified the role of informatics in evidence-based practice and patient safety. I feel I met this goal at 100%. Professional roles construct, learning objective number 6, differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients or clients as a member of the interprofessional and intraprofessional healthcare team. Course number 4540, Care of Communities. This was my CBL assignment. For my CBL assignment, I presented a teaching plan for the elderly in my community of Port Neches for a disaster, if a disaster was to occur. The elderly, in my research, the elderly, their best preparedness for a disaster is to have a personal support network. I, in my teaching plan, helped them to establish a personal support network. I created a handout titled My Support Network, and during my teaching assignment, I helped the elderly and ask questions and answer questions in order to fill out their support network disaster plan effectively. Learning objective number 7 demonstrates professional integrity, effective communication, active inquiry, and service to the community. This I combined with learning objective number 6. It's still the course 4540, Care of Communities, and it is also my CBSL assignment that I currently just described. My 5-year plan. My husband was recently diagnosed with multiple sclerosis so kind of hesitant to make a 5-year plan because I really never know what's going to happen. And also having the 3 kids, but I tried. So this is what I got for my 5-year plan. For 2019 to 2020, I plan on completing my ACLS and PAL certification through LIT. And I hope to transition from pediatric to adult hospice care. I've been doing pediatric hospice for about a year, and it's extremely difficult. So I hope to transition into adult hospice care. I enjoy hospice care, and I feel that I would be better to assist adults rather than children. The next year, the following year, 2020 to 2021, I hope to obtain my certified hospice and palliative care nursing certification. And then from 2021 to 2024, I hope to obtain my master's degree in education. I plan on doing this through Lamar University's online program. Thank you for listening to my presentation.